Okay. Hello, sir.
Hello.
A very good morning to all of you. Today we have a Dr. Ashok Singhai from Singhai Eye Care Hospital from MP. So we are talking about glaucoma. Imagine slowly losing your eye vision without even realizing it until one day the world around you start to fade. This is the reality for millions of people suffering from glaucoma, a silent but a devastating eye disease. But here's the good news: blindness from glaucoma is preventable, is detected early. So, today we have a very respectful and very wise Dr. Ashok Singhai. He will tell us to understand glaucoma and tell us about what is the impact of glaucoma in our life. So, please tell me what is
Now,
glaucoma?
first of all, I would like to give you what glaucoma is. So, glaucoma is one of the condition. It is a neurological condition having disc changes, field changes, and the intraocular pressure may rise or may not be rise. This is a condition. It is usually the senior person, elderly person. They usually affect diabetics, myopia. These are the conditions where the prevalence of this glaucoma is more.
Okay, shall I start a question?
Yeah,
Okay. What are the glaucoma and why it is called of a silent thief of sight?
glaucoma is a condition of usually raised intraocular pressure with field changes and disc changes. Usually, it is a silent killer. You do not notice it, and gradually your sight reduced, and at the end, the person become blind.
Okay.
So the importance of this condition to know and prevent from the blindness, because it is a irreparable sight loss. That's why this is important.
Who is at risk to developing glaucoma and how can they identify the early warnings?
Now, as I told you in the beginning, the elderly person, the myopia and diabetics, and the patient having family history of glaucoma. There are certain drugs like steroids for prolonged use, they can give you glaucoma. Certain eye condition like any inflammatory eye condition like iritis, they can lead to a secondary glaucoma.
Is, is there any other kind of symptom of glaucoma?
Symptom, there are two type of glaucoma. One is simple glaucoma, the other one is congestive glaucoma, yeah, angle closure glaucoma. The simple glaucoma usually they present with visual impairment, with gradual diminution of vision, frequent changes of near glasses, and in routine examination like myopia, diabetics, you may get this simple glaucoma. And the other one is complicated angle closure glaucoma. They usually present with painful redness eye, with colored halos and headache. And routine examination, you may get a raised intraocular pressure in these cases.
Okay, thank you. Many people believe glaucoma only affect on their elders. Is there true or can younger individual children are also at risk?
Younger children are also in risk. Usually, the myopia, as we seen, and the patient having family history of glaucoma. In those cases, there is a screening of those patients is necessary. Young patient can also affect even congenital glaucomas. They are
Understood.
yes.
Okay. How often should one get eye check up to ensure early detection of glaucoma?
Usually, every 6 months is necessary to get the checkup, especially those who are myopes, those who are even high number of hypermetropia because they are having small size of eyes, and diabetics and elderly person, and person those who are having frequent change of presbyopic glass. It is very important. and the blazers having the practice of putting steroid in their eyes in the form of pyrimone eye drop. It's a very common and very everywhere available drug which very frequently used by the peoples. So in those cases, there should not be any use of steroid and they have to screened out for the glaucoma.
Okay. Is diagnosed with glaucoma with a treatment option are available and how effective are they in preventing vision loss?
The first of all, the detection of glaucoma is very important. Not only the intraocular pressure, the glaucoma has to be detected by corneal thickness measurement, the angle examination, the disc photography, the OCT of disc, and the field changes. So it's a wide field examination of all the things. And once you label as a glaucoma, you detect whether it is a angle closer glaucoma or whether it is a chronic simple glaucoma. If it is a simple glaucoma, then the medicine is the treatment of choice. If the medicine failed to control the intraocular pressure, then surgical intervention is required. The other form, angle closer glaucoma, having two modality of treatment. One is laser iridotomy, or the second one is open surgery trabeculectomy or small incision glaucoma surgery.
Is there any other advice you will give to us?
Frequent examination and the treatment has to be continued without any interruption. This is very important. You should not, आप अपना खाना खाना भूल जाइए मगर कांच बिंदु की दवाई ग्लाकोमा की दवाई ना भूलिए.
Definitely.
This is very important. And
Yeah.
frequent checkup of intraocular pressure by your specialist doctor is very necessary. केवल बाहर टाइटन में और जो नई नई मॉडलिटीज आजकल आई हैं उनसे ग्लाकोमा नहीं पकड़ा जाता है. वहां केवल नंबर का करेक्शन होता है. याद रखिए, केवल आपके डॉक्टर ही इस बात को पकड़ सकते हैं.
So, thank you so much, sir, for having us, and please thank you for giving me a very beautiful and very good points about glaucoma, and thank you so much.
Thank you. Thank you.
Thank you.